Assalamu alaikum. I am Dr. Silvia Paroi, Assistant Professor of Community Medicine Department at the Akij Medical College, Khulna. Today we discuss about purification of water on small scale. In previous lecture we also discussed the purification of water on large scale. Today we see purification of water on small scale. Purification of water on a small scale have some methods. One of them is household purification of water. There are also three methods. Three methods can be used singly or in combination. At first we see in boiling. Boiling is a satisfactory method of purifying water for household purposes. To be effective, the water must be brought to rolling boil for 10 to 20 minutes. It kills all bacteria, spores, cysts, ova and yields sterilized water. Boiling also removes temporary hardness by driving off carbon dioxide and precipitating the calcium carbonate. The taste of water is altered, but this is harmless. Second method is chemical disinfection. In chemical disinfection, we use bleaching powder. Bleaching powder or chlorinated lime is a white amorphous powder with a pungent smell of chlorine. When freshly made, it contains about 33% of available chlorine. It is, however, an unstable compound. On exposure to air, light and moisture, it rapidly loses its chlorine content. But when mixed with excess of lime, it retains its strength. This is called stabilized bleach. Bleaching powder should be stored in a dark, cool, dry place in a closed container that is resistant to corrosion. Secondly, we use chemical compound, that is chlorine solution. Chlorine solution may be prepared from bleaching powder. If 4 kg of bleaching powder with 25% available chlorine is mixed with 20 liters of water, it will give a 5% solution of chlorine. Ready-made chlorine solution is different strength are also available in the market. Like bleaching powder, the chlorine solution is subject to losses on exposure to light or on prolonged storage. So, this solution also kept in a dark, cool and dry place in a closed container. Third compound is high-test hypochlorite. High-test hypochlorite, or it is also known as perchlorone, is a calcium compound which contains 60 to 70% available chlorine. It is more stable than bleaching powder and deteriorates much less on storage. Fourth compound is Chlorine Tablet. Under various trade name, that is halogen tablet, are available in the market. They are quite good for disinfecting small quantities of water, but they are costly. Fifth compound is iodine. Iodine may be used for emergency disinfection of water. 2 drops of 2% ethanol solution of iodine will suffice for 1 liter of clear water. A contact time of 20 to 30 minutes is needed for effective disinfection. Then sixth compound is potassium permanganate. Once widely used, it is no longer recommended for water disinfection. Now we see the third method, that is filtration. Water can be purified on a small scale by filtering through ceramic filters such as Pasteur Chamberlain filter, Barkfield filter and Catherine filter. The essential part of a filter is the candle. And next method is ultraviolet irradiation. Germicidal property of ultraviolet rays have been recognized for many years. Ultraviolet irradiation is effective against most microorganisms known to contaminate water supplies like bacteria, yeast, virus, fungi, algae, protozoa, etc. This method of disinfection involves the exposure of a film of water up to about 120 mm thick to one or several quartz mercury vapor or lumps emitted ultraviolet radiation at a wavelength of 254 nanometer. Then another method is multi-stage reverse osmosis purification of water. Multi-stage reverse osmosis purification process is used to make water both chemically and microbiologically potable by reducing the total dissolved solids, hardness, heavy metals and disease-causing bacteria, virus, protozoa and cysts. Now we see disinfection of wells. Wells are the main source of water supply in the rural areas. The need often arises to disinfect them, sometimes on a mass scale during epidemics of cholera and gastroenteritis. The most effective and cheapest method of disinfection of wells is by bleaching powder. Potassium permanganate should not be used, and it is not a satisfactory disinfecting agent. Now we see the steps in well disinfection. There are some steps. First, find out the volume of water in a well. That first measure the depth of water column, measure the diameter of wells, then by one calculation it measures the volume of water. Then find the amount of bleaching powder required for disinfection. Estimate the chlorine demand of the well water by Horrocks apparatus and calculate the amount of bleaching powder required to disinfect the well. Then dissolve the bleaching powder in water. Bleaching powder required for disinfecting the well is placed in a bucket and made into a thin paste. More water is added till the bucket is nearly 3/4 full. The contents are stirred well and allowed to sediment for 5 to 10 minutes when lime settle down. The supernatant solution, which is chlorine solution, is transferred to another bucket and the chalk or lime is discarded. Then deliver the chlorine solution into the well. Bucket containing the chlorine solution is lowered some distance below the water surface and the well water is agitated by moving the bucket violently both vertically and laterally. This should be done several times so that the chlorine solution mixed intimately with the water inside the well. Then need contact period. A contact period of 1 hour is allowed before the water is drawn for use. Orthotolidine arsenite test. It is good practice to test for residual chlorine at the end of 1 hour contact. If the free residual chlorine level is less than 0.5 mg per liter, the chlorination procedure should be repeated before any water is drawn. Wells are best disinfected at night after the day's draw off. During epidemic of cholera, wells should be disinfected every day. Today we like to end my lecture. Thank you everybody.